You've said that a lot of people use Google instead of going to a doctor to try to diagnose their symptoms, whether they think they might have hemorrhoids or something else that's going on with their GI system. And so I did a little bit of research on the search volume of hemorrhoid-related searches. Obviously, most of them are questions that one could or should ask a doctor.
Or Dr. Google.
Or Dr. Google. What I do know is that when I Google hemorrhoids, and particularly whenever the images show up, I'm actually worse off than I was when I didn't know the answer to my question, which is something, quite frankly, that we're trying to change with norms, which is how do you deliver information or even imagery that's educational, but also doesn't prevent people from diving in deeper.
Most people can manage their hemorrhoids through lifestyle interventions or over-the-counter treatments. Very rarely do people actually need medical treatments. And it's a spectrum. Mm-hmm. When people ask me, what can I do about my hemorrhoids? I always ask them, like, how bothersome is it to you? Because there are more definitive treatments, whether that's surgery or in-office procedures to treat your hemorrhoids. But that also comes with symptoms. No procedure is without risk or symptoms, and so a lot of it just depends on how bothersome their hemorrhoids are to them. I wonder if it's the opposite effect, that the lifestyle choices you're making that cause back pain may also predispose you to hemorrhoids. So prolonged sitting, we talked a lot about that, and so maybe they're experiencing hemorrhoids and back pain at the same time, but it's more that they share a common cause. So I think the frozen peas might actually be helpful because there's ice in there. Having hemorrhoids, it's inflammation, and ice has an anti-inflammatory effect. The pillow part may be therapeutic emotionally, but probably not medically therapeutic. I think squatting can aggravate your hemorrhoids because you're putting more pressure in that anal region. Squatting to have a bowel movement in general is recommended. It kind of aligns your colon so that you can evacuate better. It sort of helps with the anatomy
which is why squatty potty is helpful.
Exactly. A squatty potty is helpful. Or people kind of can use a trash can as a makeshift squatty potty
that's my travel trick.
If you're traveling. Exactly.
That's why there's always a trash can in front of the toilet when we go to hotels. Got it.
But the goal is, by putting yourself in that position, you're minimizing the amount of time that you're on the toilet because you're in this anatomically favorable position so you can evacuate quickly.
Got it.
But if you're squatting, and I assume in this suggestion, you're supposed to be squatting for a long time, you're just applying pressure to that area without, and if you already have hemorrhoids, it's increasing the pressure in the area. Itching is one of the most common symptoms of external hemorrhoids.
If someone's butt itches, is it absolutely hemorrhoids?
No.
And if not, what else could it be?
So there is a condition called anal pruritus, or
sorry, can you say that again?
Anal pruritus, where you just feel itching around your butthole. You don't have a hemorrhoid. There's nothing abnormal around there. You just have the sensation of itching around there.
How common is that?
That is not comfortable.
It's not as common as hemorrhoids, but it's certainly something that I've seen and treated.
So it's like a bacteria, like a butthole bacteria?
No, it's more of a sensation issue. Like a nerve issue.
A nerve issue?
Yeah.
So it's not a function of hygiene?
No.
What someone's wearing?
Would any of these products help that? Or is it more?
No, it maybe the wipes might help kind of provide some like cooling relief, but it wouldn't treat the underlying problem.
Yeah.
And then certain types of infections, so certain types of worms, especially like children, will have the symptom of perianal itching, and that is a symptom of infection.
You must be very fun at a dinner party.
Very.